Welcome to The Lens, hosted by Catalysis, where we get a glimpse inside healthcare organizations that are transforming to a culture of improvement to deliver continually higher value outcomes for patients, staff, and communities. Visit createvalue.org/The Lens for more information about Catalysis.
Thank you for tuning into The Lens. I'm your host, Peter Mariahazi. Today, I'm joined by Ted Toussaint. Ted teaches, writes, and consults on healthcare innovation both independently and with Catalysis. Today, we're discussing new care model development. Hi, Ted. Thank you for joining us today.
Hi, Peter.
Before we dive right in, tell us and the audience and our listeners a little bit about yourself.
Sure. So I'm a Catalysis faculty member. I specialize in new care model development. Prior to that, earlier in my career, I worked at an organization called Atrius Health in Boston, where I helped create the Atrius Health Innovation Center. And our goal there was to create a reliable and repeatable process to design and introduce new care models to the organization. During my time there, we ran a number of different projects using design and product development processes, and then translated those into the context of care models. Now I consult and coach around many of the things we learned while I was there at that group.
Sounds like a very exciting time at Atrius. What does new care model development really mean? Help our audience understand that.
Sure. I think a good place to start is that healthcare delivery systems, as we understand them, are really businesses that are built entirely around the delivery of care models. So care models are at the core of the way value is delivered to patients. And in addition to delivering value to patients, successful care models also should provide a good place to work for the care teams, and also deliver business results for the system. And so with those care models at the center, that really becomes the driving force behind any change that we may want to make that has impact. Now, at the same time, we have a lot of environmental changes happening around us today in the healthcare industry. So it could be political or changing consumer expectations or increased competition from outside of the industry, a lot of tech companies trying to come in and get involved in healthcare. And probably the most important one, the gradual but continuous shift to value-based payment models. And these environmental changes happen. As these environmental changes happen, the care models, so those are really the core of the value proposition of the health system, those care models have to change and adapt to remain viable in that different environment. Sometimes those changes can be incremental improvements. Sometimes they need to be big value stream level improvements. And sometimes those changes, the change that's required is so deep that the care models actually need to be fundamentally redesigned from the ground up. And this last concept of redesigning from the ground up, that's what we mean when we say new care model development. So it leverages a team of divergent and disruptive thinkers that are pulled together to use a design and development process. That team then, through that process, casts a vision for a radically different future, goes through the rigorous and disciplined process to make sure to make that future become a reality in the form of a new care model that's running in operations.
Well, that explains why it's very important to healthcare, because there's a lot going on, right? The whole marketplace and everything is changing, and there's a lot of levers being pulled in healthcare, both from payment and from delivery. So sounds like your innovation really helps organizations take a look at that, doesn't it?
Mm-hmm.
So I know many of our listeners work in a culture that emphasizes continuous improvement. How is a new care model development different from the typical continuous improvement you hear about?
Well, I was thinking about this. I think that's really like comparing apples to oranges, because continuous improvement can exist anywhere. It's a pretty broad concept. How can we make what we are doing better is a question that never really goes away, regardless of the environment you're in. So the main difference that I think people should be thinking about it in the delivery system is, in healthcare, we're usually talking about applying continuous improvement to the delivery system. And that's a bit different than what we're talking about, which is using a development system to design and build a new delivery system. So to translate it into the Toyota world, Toyota has the Toyota production system for manufacturing automobiles, but Toyota also has the Toyota product development system, which is used to design those cars that are going to be manufactured. Now, continuous improvement is embedded in both of those systems, but it looks different in each because the nature of the work is fundamentally different between a development team and a delivery team. So what we're talking about with new care model development is really having that design and development team that's building a new care model. We can be doing continuous improvement in that environment. How can we get better at designing new care models? And that's important, but it's also different than how can we be applying continuous improvement to always be getting better at delivering the existing care model, which is what we need to do to keep operations running today.
And developing a new care model, that sounds like a significant commitment on the part of the organization to say we need to have this and we need to allocate the resources to it. So when should an organization on the transformation journey really begin to focus on new care development? When do they start looking at that and say, you know, we're ready to build that out?
Yeah, I think first you would want to understand whether or not the external market forces are such that it requires fundamental redesign of the system. My experience has been that generally organizations that are in highly competitive markets might feel that pressure to redesign, and also organizations that are really pushing to aggressively move into value-based contracts and arrangements with their payers, that usually lays a platform for design. So I think that sets the need for it. And then in terms of where on the transformation journey, if we think about the catalysis roadmap, transformation roadmap, I think there are a few things that could be in place prior to embarking on new care model development that would be really helpful. The first and most important is probably some process for prioritization and deployment of strategic initiatives at the senior leadership level. And new care model development requires mobilization of resources across the whole system. And you're going to need to pull in operations, contracting, legal, finance, Epic, IT, all of those functions need to be engaged to do redesign work. And if we don't have a way to coordinate those resources of who's doing what and prioritizing their work, there's no way that things like this can get pushed through the organization. The development team will end up fighting the organization, and the organization will ultimately end up probably killing whatever they're trying to bring into operations. So I think that's probably the most important thing, is have some kind of prioritization mechanism at the leadership level, and then establish improvement systems and basic A3 thinking. If we have that kind of spread through the organization, that is also very helpful foundational work to make sure new care model development is successful.
Well, you know, you mentioned the cross-functional importance of involvement in new care model development, and you mentioned some very specific indicators. I would imagine one of the indicators would be that all the cross-functional areas are willing and have an interest and understand the importance of that new care model development to the organization and to the community. Is that right?
Yeah, I think there's usually various levels of understanding or interest, and so it becomes important for leaders to also communicate the vision. I mean, if it is a strategic direction for the organization, that needs to be communicated from the highest levels, and you know, the local business unit leaders need to develop that into their strategic plans to support the enterprise. And so if new care model development isn't engaged at that level, it becomes very challenging.
That's pretty consistent across all the things we deal with. If you don't have that level of engagement, it kind of tends to wither a little bit, doesn't it? Can you share some examples of new care models that you have seen in your time working with multiple organizations?
Yeah, I think the examples that I understand the best are from my time at Atrius. Atrius Health was is a large multi-specialty medical group. They don't own any hospitals, and they're very far down the value-based payment journey. And so as we were digging in and doing research for our design, for our care model designs, one of the things that came out was this need to keep elderly patients out of the hospitals. And for many organizations, having patients in the hospitals generates revenue, but for us, having patients in the hospital was an expense. And so if there were opportunities where the patients didn't need to be in the hospitals and they were in the hospitals, we wanted to find a way to keep them out. So 2 care models that were developed to do that using the process were the care in place model, which was a home-based urgent care program for elderly patients, which basically intercepted elderly patients on their way to the emergency room in real time with visiting nurses to prevent unnecessary ER utilization and subsequent hospitalization. And the second one was a partnership with a startup called Medically Home. And the Atrius team actually developed a fully scalable hospital at home program where patients are admitted, quote, into the hospital in their house, and people come and bring all the equipment to their home and are admitted for a 30-day episode. And that has been, they've been testing that for the past couple of years, and it's had remarkable results. I think they've reduced cost of care by 20 to 30% compared to equivalent hospital care, and they've kept those patients out of the hospital and in their homes. So those are 2 examples. I think a third example that a company that I've admired for a long time is a group called Iora Health, and they're a primary care group that have different offices around the country. But their model is basically for primary care. They reimagined that. So traditional primary care is a patient has a relationship with a primary care physician or maybe a primary care nurse practitioner. That's their PCP. And that person directs the majority of the care that they receive. In this Iora model, they decided that the majority of the value that the patients were going to get was in more behavior change type work that needed to happen, lifestyle adjustments. That's really where the wheelhouse for some of these primary care patients was. And instead of having a physician be the primary care provider, each patient was partnered with a health coach, and that became their primary relationship in the model. And so they've actually done a lot of work developing that out and have had quite a remarkable results from that too. But it's an example of where they just kind of changed the paradigm of what primary care is and how it works, and by kind of rethinking it from the ground up.
Thank you for that. It sounds like in those examples, obviously the care of the patient still stayed foremost. And I imagine there might have been even some secondary benefits from the in-home care, things like that, where the patient was more comfortable, was at home, wasn't in a hospital setting, and appreciated that as well.
Yeah, I think there's clinical benefits, and then what we do in the new care model development work is go out and do deep ethnographic research on the patients to understand their unmet needs. And so one of the unmet needs that was identified for those patients was to stay in their home, because when they leave their home, they start to lose their autonomy. They don't feel like they have control over what's happening. And so keeping them in the home, there are clinical benefits to that, but there are also non-clinical experiential benefits that the patients get from that too.
Great. Okay, now let's go to the other side. What are some of the biggest hurdles that organizations run into when they begin developing new care models?
Yeah, I think one of the biggest hurdles is probably patience, with a C, not patience with a T. The new care model development work requires a team to challenge underlying assumptions about the way things work today and they have to develop new mental models for how we define value and what winning means for the organization in the future. So the existing performance metrics of how we define success today may not be the way that we need to measure success in the future, and that requires a deep rethinking. And that process requires time. It requires time to allow that team to depart from operations and follow different research rabbit holes, do that deep ethnographic study of the patients and stakeholders that I was talking about just earlier. And my experience is that these upfront learning phases can take 3 to 6 months to complete, and leaders are not, in health delivery systems, leaders are not used to waiting that long for action. A lot of healthcare delivery cultures, productivity is defined as more as task completion. And in this upfront work, we really need to start changing our mindset from task completion to measuring productivity as knowledge creation. And that's a very challenging leap for some people. And for those that can see that, usually it's easier to have patience for that initial upfront phase. But there will always be people that struggle with that. So I think that's a big challenge that people struggle with. And then another hurdle is just, most people probably have this hurdle, is resource dedication. So health system leaders are in a delivery system mindset. They're not necessarily thinking about R&D as a separate function, which it is. You can't redesign a system without taking some people out of operations to do all that heavy lifting. So if you don't do that, the urgency of daily operations will always beat out the time spent on development. And so development will be naturally deprioritized. So that's difficult, I think, for some leaders to stomach. It gets challenging to especially dedicate providers to system design, because we're taking them out of revenue generating roles. But without having some level of dedicated resource, it's very difficult to create breakthrough change and really change that thinking that we were talking about, changing those mental models and changing those underlying assumptions.
So in your role, how do you help them overcome those challenges? A couple of times you referenced the leader's thought process and their standard and paradigm of expectation of productivity. How do you help them see the benefits of thinking a little differently?
Yeah, I mean, overcoming those, the first and easiest way is probably just to be very clear up front and communicate those challenges so people can anticipate that they will need to be patient and that it is going to be different and it's going to feel different. And people go in with that expectation, that can help a lot. But other than that, I would say one way to kind of de-risk the whole resource investment thing would be to start small, to experiment and learn. Put a small team together, get a coach, commit to completing one full development cycle and see what happens. Protect that team from the organization as best you can, see what they learn. It's an emerging capability in health systems, and so it has to be organically grown from within. And we need to expect that there's going to be some organizational learning process that's going to take some time. So when that happens and we start to gain that experience and we start to see some initial results, then leaders can decide whether or not to invest more in that capability, grow the team, or empower the team to take on larger care model projects, larger scope projects. That just helps de-risk the upfront investment and decision-making for leaders. Though there's always going to be risk in doing something new for the first time that the organization's never done before. So at Atrius, we started with a dedicated team of 2 people, and then we had part-time leaders that were a part of that team and an external coach. And that's how we started. Eventually, that team expanded to be 15 people, and with that group, we were able to deliver much more robust care model designs and deliver on those patient, provider, and business results that we talked about earlier. But that didn't happen overnight. That took time to grow.
Ted, thank you for that. The connection between exploring new things and risk is clear and obvious. kind of to close us out, is there anything else you feel that is important that we really have not touched on yet?
Yeah, I guess the last thing that I would talk about is what people is just the terminology that we're using, care model development, and an intentional shift to move to that versus a lot of people talking about the term innovation. And I think innovation is a very broad term, and a lot of people think about technology when they talk about innovation in healthcare. It's a buzzword that people grab onto, but it has a different definition for everybody you ask. So I think what I found is that new care model development really can be a driver of breakthrough innovation, and used as a platform to introduce new technology, and can actually be used as a way to protect an organization from investing in technology for technology's sake. So that's one other benefit that I want to throw in there for this type of work.
Ted, that's a great clarification, because we all have our biases on what words mean and what we think. And so being clear is obviously very important, because it takes a lot of dedication on the organization. Well, Ted, thank you for joining us, and thank you all for listening. Visit createvalue.org/thelens to learn more about how Catalysis can help accelerate your organizational transformation. We can develop a transformation roadmap customized to meet your organization's specific needs.
Thank you for listening. Visit createvalue.org/thelens to learn more about how Catalysis can inspire you to accelerate change in your organization.